we have to get serious about separating out what we mean by data versus what we mean by intelligence.
Yeah.
If you want to have a real conversation about what's the difference between the human and the machine, the data should be the machine and the human is the intelligence. And we've got the ability to do smarter stuff with intelligence now.
You're right. There's no shortage. There never has been any shortage of data in healthcare, but the intelligent use of that in terms of giving us insights that can do something for us, that can make something better, is really important.
Hello and welcome to The Connection, where RLDatix's Chief Customer Officer Liz Jones and Medical Director Darren Kilroy are joined by leaders and colleagues from within the healthcare industry. In The Connection, we explore how people and technology in healthcare can come together to create great experiences and support patient safety. We hope you enjoy listening.
Welcome to the Connection podcast. I'm Darren Kilroy, Medical Director here at RLDatix.
And I am Liz Jones.
Thanks for joining us.
All across the country, as a nation, there will be people getting ready for the NHS Confederation Expo, which opens up on Wednesday. We've got an absolute smorgasbord of guests that we're going to be chatting to about some really interesting, challenging topics. But today, there is some stuff to talk about. There's spending review. You with your old professional hat back on will be interested in what was released last week. We know that health is going to be one of the phrase that the media...
The winners.
Yeah. That's right. The winners and losers all feels a little bit difficult language for me. But I guess we got the first hint of what it meant to invest further in health with the release of the urgent emergency care plan last week.
Yeah. It's interesting, isn't it, this week? Because as you say, there's such a lot going on. And I think what's really important is when we get such a rapid fire of news and releases of big documents and big policy, we've got to try and find a way through it all and make sense of things and sort of calibrate where we're going to devote our attentions to, haven't we? It's difficult because some things are strategic, 10-year plan, clues in the title. And then we've got something which is inherently and always is really operational, urgent and emergency care plans for this winter and into the next spot, basically until spring, which is really important if you're a patient in urgent and emergency care, because we know it needs a lift. And around and about all that, we've got the spending announcement in the middle of all that, which will inform all of it. So it is a really interesting week, and it's no coincidence, I think, that the Confed event Expo occurs in the middle of all that. It's a great opportunity to harness opinion really quickly on what's been said and what's been released, and that's a really important part of this week's agenda, to be honest. Yeah.
And so when we originally conceived of this podcast, I think we were very conscious of the fact that it wasn't going to talk necessarily to the leaders, or certainly not just to leaders, or just to policymakers, or just to people who are super interested in the technical kind of things that are happening. And instead, it would be more holistic in terms of it would talk to people about what's happening with this thing that affects the fabric of our lives so much. So if I can step you back, policy, lots of things going on, spending review, big changes in terms of access and particularly around the urgent emergency care pathways. So if you're I know, we like to talk about my mom quite a bit on this podcast. Yeah. She doesn't know, by the way.
No, one of these days, well, she'll be a guest one of these days.
But if you were my mom or any of our family members, what do you think that last week means to you in the context of access?
Well, that's a great question. I would hope that it means that if you have the misfortune to require health and care services or social care services in the coming months, that if you don't experience anything in a faster or more efficient way immediately, at least you have the confidence that the entirety of the, for want of a better expression, the healthcare system is behind you and recognising that there is a need to do things better. There was a really interesting phrase in the preamble to the emergency care announcement that came last week, which really struck me, was that, and I might be paraphrasing it slightly here, that we've obliged staff to normalise providing suboptimal care, was a statement in the blurb. And I thought, if you're a patient and you're needing that care, the recognition that's recognised as not being where it needs to be, and that is now being addressed in a very specific and explicit way, gives you confidence that people are doing all they can to improve your experience when you next need to go to your out-of-hours GP or to an A&E department or whatever you need to do, that there's a lot of interest being taken in the experience that you have and the quality of it. And that's been done before, be it elective care or any domain of care. Policies come out, plans come out, but this one's quite a significant one in its wording. It's very strong in its wording. So if your mum is having to go to a facility for any reason involving health and social care in the coming winter, specifically out of hours care and emergency care. But it's that recognition, I think, that things are being done behind the scenes to make it as swift and as of high quality as possible for you. You might not see it immediately, but things are being done.
Yeah. And do you think, what's your view in terms of how much better we collectively, the ecosystem around health and care, as well as the people who are right central delivering either the policies or the actual care delivery, how much better do we have to get at telling that story to citizens? Because that's not the way these things are told.
Roll. I know it's not. I think that there's something for everyone in these things. I think you're right that there's a real need to approach what's being said and what's being released and published through the eyes of those who it affects the most. And we all have a part to play in that. There's a heavy reliance on, let's take an example, the emergency care document that was released on the 6th. There's a heavy reliance on that in patients being able to use wearable tech or being able to access the app, the NHS app and things of this nature. And lots of people, quite understandably, don't know how to do that yet. And for lots of people who are working in the service, it's making better use of the available technology you've got, be it workforce governance risk, whatever it is that you're looking at. It's not necessarily doing new things with that. It's doing what you do better and more consistently. I've often said this over at podcasts in professional life, I think. The marginal gains of incremental change, if we all make one tiny improvement in something that we do at the scale of the NHS, I mean, the manifest change that brings is massive. So I think there's something for us all to go away from these plans and documents and releases and think, how can I help my neighbour, a loved one, and somebody I'm caring for if I'm working in the service, or someone I work with if I'm working in a tech company? What one small thing could I suggest that people do tomorrow differently that might help them just do something a little bit better or think about things a little bit more laterally? And all that collective thought will shift things along. Because that's really how most of the improvements happen, unless there's some massive revolutionary change that, the release of some new wonderful drug that's been waited for a decade, that's clearly significant. But in the majority of cases, things happen incrementally and across a huge platform. And there's so much we can do there with tech and helping people to use it, as I say, more efficiently, more smartly, because there's a ceiling of capability in the tech that often we don't get to.
So there's a real balance to be had there because, as you were saying, unless some great revolutionary drug comes along, and we've actually at a moment in time where potentially we've got two super revolutionary things happening. Okay, so one is drugs around obesity prevention and all. Not going to get into that.
Sure.
A lot of controversy around that we don't want to do today, but it is something that's material. And if we think about triple shift in terms of prevention, and then at the same time. And we're going to be talking about AI a little bit at Confed.
Yeah, looking forward to that.
As are many other people, some really great sessions on it. But it is without doubt now in the patient-focused way, as opposed to the way perhaps we've become used to talking about it in healthcare, which is around radiologists and back office functions and the gentle. It's okay, it's here, it's your friend. It's trying to take away a few admin tasks. But what we're seeing happen now is a complete shift in terms of what this means for patients, families and service users and how they use it.
Yeah.
Is that not a revolution?
I think the revolution for me that comes around all that's being said, the underlying thrust of it all, which I think is really interesting and is significant, is there's this sort of democratisation of the data in a way that was never been done before. There's reference, going back to it for a second, to the urgent and emergency care plan, to the ways in which providers will be obliged, not aspirational, will be obliged to use their existing data more intelligently and evidence that they're doing that. It's the democratisation of that now because the public are in a position now where it's much easier now to look at all that performance data in real time and see how your care system, if you so choose, is getting on with looking after people. And I think that's the most significant thing now. It's the way in which the evidence and the real-time data of what's going on is being used, and the obligation is there, and the expectation is there now from the centre, for want of a better word, that will be used, and you can show that it's being used every day to greater transparency than before. I remember seeing evidence exists, presentations have been made of the ways in which, for instance, risk and incident reporting behaviours differ amongst different socioeconomic groups in healthcare, and that's something that remains to be solved.
There is a revolution in the technology happening, not because of what AI can do for healthcare systems, providers and professionals, but because of the way it's going to change what we as patients, carers, citizens do. I've got some lived examples of this. As always, I put myself out there experimenting with this stuff. So I genuinely have been taking some recent blood test results and decided that I was just going to knock them straight into chat and see what it said to me.
Yeah.
I had one of the most human interactions of my entire life. This thing, I came away from it actually feeling like I needed to lie down because the machine cared for me, Darren.
Well,
and I know, right? So again, notwithstanding the fact that I come from pretty much all of the privileged tick boxes of life is good, I'm very lucky, very fortunate person. So I get access to a bit of electronical kit that allows me to do it. I've got Wi-Fi. There's loads of people who don't have access to broadband still in this country. So I'm very fortunate. But nonetheless, I was astonished at the human interaction I had. Discuss.
As a clinician. Crikey, it's like my survivor question. I think, well, it's not as a clinician. I think it's just as a human being. What strikes me about that is that, all right, as a clinician, here's the thing. What we see, what we have seen, what colleagues tell me they've seen in primary care, of course, is because of that very description you've given there, it creates a new stream of demand based on what people have found out on their phones to then go to see a real doctor, to have a discussion around the nuances of that which weren't captured in the chat, and then to figure out a way to disabuse people of the concerns and queries that have arisen from that, and to unpick it and find a way forward. And that is the essence, again, of AI versus human. And that's just one example from primary care. You replicate that through the entirety of the care and social system. And we have to be lively to the reality that that might well be and is going to be something that will need to be addressed in terms of capacity to manage those situations.
And I totally understand that it then feeds a entire different sort of set of questions, need for interactions. My point was actually a little bit more basic than that.
Sure.
It was the way in which it was delivered. It was so human.
Sure.
And it struck me, therefore, that it was, and I would consider myself to be alert to all of the, you can't trust necessarily the entire data sources it's using. It's not a person. It hasn't got all of the experience that you would get when you sit in front of that person who sees you holistically and sees you physically. But it was astonishing. It was the language. It was, I was like, that is a first. So how do you think that will change? Take away all of the change in practice, but people are going to be different.
Yeah.
Are our expectations going to shift?
I mean, expectations shift all the time, don't they? And wax and wane and become more nuanced. I think that there's no doubt that if you have an AI response that it feels more human and more on your wavelength than the standard clinical consultation does, then there's something to be said there around the culture shift needed still in how people interact with patients and other people.
What's your thoughts in terms of how that has to shift now in light of this different experience that citizens are going to have?
Yeah, well, that's a great segue teaser for a future podcast when we're talking to a trainee doctor for sure. And so I'll be interested to hear what she thinks about that and others. And to be honest, I don't know right now what I think about that in terms of the fact that there's so many different ways in which we're interacting with, you mentioned chat on the phone there, and AI algorithms that are already built into lots of decision making in clinical medicine, that it's such a vast topic. I think what we'll find now, and it might be a cop-out answer, but I think it's true, is that we're going through a discovery phase now of how we're going to settle ourselves against this new way of doing business with healthcare in a way that we did when penicillin was first launched into the market or other things of that nature, when the internet first became a real thing. They seem like ancient history now, these things, but they're not that long ago. And I think we're in that sort of phase of discovery now about how it'll all sit alongside the human brain and how our brains will adapt to this and how the tech will adapt to that. Because obviously the tech is fundamental, we hope still, will be ultimately controlled by human beings in some shape or form. And it's an interesting time to be involved in it, whether you're a patient or whether you're a healthcare leader or whether you're a technology leader at a global or local scale. It's a very interesting time to be involved in this story because we're laying down the story here, I think, of how we're all going to interact with each other in this new world. And where will it end? What will the capabilities be? Not the world, the possibilities. They're probably all going to end one day, but hopefully not before the podcast series. And we'll have to reach a position whereby we are settled with what we're doing. Otherwise, we'll always feel a little bit skittish and nervous around it, which won't help us.
Yeah, and I think one of the things for me there is sometimes there's some stuff that feels quite abstract and dull, like getting data right through whichever platform.
Yeah.
We all know now that the technology can kind of deal with any data that you throw at it, but actually data quality is still something that could become unfashionable.
Yeah.
And yet quality of data, verified data, I think might actually start to become even more interesting. And there's some of those things that clearly have been worked on as part of the wider set of plans here. I feel like really important hygiene factors for a national service.
That's a great point. You remember when we did the great podcast with Henry Morris not long ago, and obviously Henry's interested in EPR, EMR systems.
I like the way you're pointing at Henry, because
he's sort of still there in my mind. And Henry will be Confed for sure. But point being is this democratisation that I mentioned, that you mentioned the points there, it obliges us to address data quality in a way that's never been more pressing, because there's so many more eyes on it now.
Yeah, exactly. Darren, there's like two schools of thought. There's the one that says just get the data out there, it will sort itself out. And then there's this other one that says this is a revolution. And actually, let's do, well, the truth is somewhere between the
truth is between the two. But we've got to try and aspire to be in the latter camp of that, because there has been historically, I remember these days of old, there has been too much rubbish quality data pumped out around all kinds of things, which leads to loads of erroneous conclusions that are, quite frankly, can be dangerous. At the very least, they're inconvenient and distracting. And even if you're looking at something so seemingly prosaic as moving on to a new electronic patient record system, I know from experience that when you do that process, and all the staff involved in that journey will feel the same, unless you scrutinize the data you've been working on and tidy that up, you mentioned the hygiene there, to put into your new system, it's really amazing how quickly you come up against problems if you don't do that. And it showed me brilliantly for probably the first time in my entire career, I suppose, that when you did that massive exercise of introduction, how much of the data you thought was all right was really not. It's just an example of how using that opportunity where the inputting of clean data was key to it being a success, how much of the stuff that was going on in the building, so to speak, needed cleaning up. So that replicated across all these different domains we're talking about now. It's a fantastic opportunity to get on board the ship of cleaning up data and making it as high quality as we can, because that will absolutely pay dividends down the line. You mentioned at the start of the podcast around the emergency care document that was released last week, and it references data dozens and dozens of times. I've never seen that before. And we can only hope that things like that, 10-year plan, other things, not so much the spending review, all these operational things that are being talked about now that mention data all over them, got to be great.
I do, it's interesting. So I also read the document, honestly, with a completely different lens to you and with not even 2% of your experience. And what did strike me, though, is that we have to get serious about separating out what we mean by data versus what we mean by intelligence.
Yeah.
And that, again, is if you want to have a real conversation about what's the difference between the human and the machine, the data should be the machine and the human is the intelligence. And we've got the ability to do smarter stuff with intelligence now. And often that's what it's really referring to is intelligence.
You're right. There's no shortage. There never has been any shortage of data in healthcare. But Lord knows there hasn't. But you're right, the intelligent use of that in terms of giving us insights that can do something for us, that can make something better, is really important.
That goes to another point then about what is the role of the smart people that we are fortunate enough to employ across a health and care system. What are they doing in the future? So obviously delivering direct care, but also asking the right questions of these data sets, because sometimes, yes, the data can reveal something that nobody thought to ask or see. Fabulous. But a lot of the time, the value comes out of actually the inquiring mind and the questions it wants to ask. So I guess that's also part of the upskilling more generally.
I totally agree.
Across the service.
And I'm always struck by, on that vein, just thinking about the operational life of running a healthcare system at a very local level, which still is really important. All the data and intelligence in the world, the computer is not going to be the one that's chairing the bed meeting and listening to the different points of view about what's important that day, that the data will inform and the insights will give you help with, but a human being still has to do that, period. And fundamentally, and at the end of all of it, of course, what really it's all about is, and I hope this is always going to be true, is that you mentioned your mum's lived experiences there, and we've talked about those before. In terms of all the tech and all the data in the world, there comes a point, that one precious moment of contact between two citizens where one's the clinician and one's the patient. And in that moment, all that information has to be encapsulated and the messaging has to be between two human beings. And it's all really fundamentally designed, in my opinion, to do that to the best of its abilities, that meeting of two people. And no technology should take the place of that. And so all that we talk about, data, insights, reform, it's got to be, to my mind, lifting the quality of every millisecond of that interaction. You might get 5 minutes between a clinician and a patient in a fast-paced environment. So you've got 300 seconds worth of time there. And in that time, you want to get as much information across both ways as possible. And all that we do with tech and everything else is really meant to inform the quality of that. It's a short podcast. It's a big week coming up. It's only less than 48 hours till the Confed Expo now.
So we've got a couple of sessions.
We have.
You're delivering a session. Do you want to talk about
we've got a really great session on day one at lunchtime. Everyone's welcome. Please come along to that. It's an interactive session, but don't be put off by that. We'll be looking at some real data in terms of a national job plan analysis that was done a few months ago. Job plans being the ways in which clinicians spend their time and the way in which that's captured in the system, so to speak. And we'll share some insights there that are hopefully, I think very interesting around how that is changing in the nation in recent times and what people are doing all day in their jobs, which is, I think, going to be really influential in us thinking about how to better use people's time. That's on day one, and we've got some colleagues joining us from the NHS to talk about that. And we'll be looking at some data from board papers, real anonymised data from real board papers, which will give it a lot of currency because it's real data. And people can make real insights from that based on their own experience. And then we've got a session, haven't we, on the second day?
Yeah, day two. So day two, we're doing a session which is around this very fundamental question, which is actually if we're trying to be more productive, if we're trying to be more citizen, person-centric, and we want to get smarter in terms of delivering some of the care pathways, as outlined last week. Yeah. And we're going to really over-index on how technology can help us do that. Then actually, how are we going to control this interface between AI and humanity? So brilliantly, we're being joined by Tim Kelsey. Many people will know Tim from the work that he did when he founded Dr. Foster. Since then, spent a huge amount of time in Australia, still lives in Australia and is doing some incredible work with an organisation called Beamtree, who have been leading the way really in terms of how AI is used. So we're going to continue some of this conversation there.
And we hope that people who listen to the podcast now will pop in and see us at the Confed because we've got a stand there. We're open all hours.
Yeah.
The shop front is open. There are ice cream. There's other things going on. We've got colleagues from RLDatix joining us there. And of course, and I think for me, the last thing I would say today is the one thing that the events like the Confed, because it's such a big event, that they're really good for it. We talk about AI and technology and humans. It's just a great opportunity to surprise to see human beings, which is sometimes a bit of a challenge these days in the world of online meetings and all the things that goes on. And the fact that so many people from the NHS and other sectors are there is always the most rewarding thing.
Yeah, absolutely. Well, we'll look forward to, I know that after Confed, we go into a really heavy policy period for the 10-year plan.
Yeah.
So I'm expecting a lot of what we talk about then to be in the context of that.
Yeah.
But watch this space.
Watch this space.
Forward to the next few days.
Yeah. Thanks for joining us on the podcast. We'll see you soon.
Good to chat. Thank you.
Thank you for joining us on today's episode of The Connection. We hope this episode has provided you with valuable insights on the role that both technology and people play within the healthcare landscape. For more information and resources, visit RLDatix.com. Don't forget to subscribe to The Connection on Apple Podcasts, Spotify, or any other podcast platform you use. Join us next time as we continue to explore how healthcare is impacted by connecting people and technology. On behalf of the RLDatix team, thanks for listening.